So how does Medicare work? Medicare sucks, right? My doctor won't see me. I gotta go to those federally whatever municipal hospitals. Medicare barely covers anything, right? Will they even pay for stuff I actually need? Jeez, why did I have to retire? Hold on right there while I discuss and go over why I think the Medicare system is probably the best health insurance you can get in America. Alright, so before we go into why I think Medicare is awesome, you first need to understand how the US medical system or medical insurance system works. The first thing that happens whenever we need any kind of care is the doctor sends in, well, the doctor sees us, of course, and the doctor says, I need to run this test. I think it might be this. Let's go ahead and see now if the insurance will pay for this test. Then the insurance company comes back with some kind of a decision. Whether or not this test is approved, maybe we need to take a different kind of test that's more economically smart, for at least for the insurance company anyway. Might not be economically saving to your time because that test might not tell you what you need to know. And then you got to do another one anyway. But anyway, I digress. Let's keep going. What happens? So the insurance company comes back with a decision. They might deny it or they might approve it. If they approve it, that's fine. You go ahead and pay whatever copay you need or deductible. Now, if they deny it, you have two options. You can either appeal that denial by saying, heck, I really think we need this. My doctor thinks so, I think so. Here's all the supporting evidence that states that I need this test done. Or you can go ahead and pay 100% out of pocket because the insurance company is saying that we're not going to pay for it. We don't think you need it. If you want it, pay for it yourself. At that point, you file an appeal if you want to appeal it. And then the insurance company will reassess their initial decision. Maybe they'll call up your doctor. They might do what's called a peer-to-peer, where the doctor will talk to a utilization management nurse or perhaps another physician on why this service is so valuable and so important to you. Are we tired yet? That's pretty much what the doctor has to do every time they get a service denied or something that gets kicked back from the insurance company. I know you're thinking, Matt, my insurance has never denied me anything. I've had great coverage. I know that my coverage will continue to be awesome as long as I keep this plan. Well, hold on right there. Because according to the statistics, the Affordable Care Act and Medicare, they do studies every year, and they found that Affordable Care Act plans, not all of them, but the subset of study that they did, which is a large subset of plans, actually denied services to their members 16% of the time. Means that basically 1 out of, let's say, 8 times service was denied to members of the health insurance plan. And you're thinking, wow, that's quite a bit. That means at least probably one person, hopefully, out of 8, hopefully I get 8 views on this video are watching, they possibly could have gotten something denied. And then, of course, it goes through the appealing process. But unfortunately, the ACA does not have the data on the appeals process and the success rate of the appeals or anything like that. But guess what? Medicare does. Medicare actually has a denial rate of about 8%. So about half of the Affordable Care Act plans. So that's 1 out of 12 people. So maybe if I got 12 views, one of you folks would have experienced this on the Medicare Advantage plans. Now, with that said, Medicare Advantage plans are different from the original Medicare program, but stick with me and I have a point to make at the end of this, I promise. So with that said, 8% of claims were denied on Medicare Advantage. Now, with Medicare Advantage, we get the added bonus of having more data. And the data tells us that of those denied claims that were appealed, 75%, that's 3/4, of those that were appealed actually were approved later on in the process. So that means that those folks who got their services denied initially ultimately got their services covered. Great, right? Well, here's the alarming part. Only about 1% of the initial 8% of all claims that were denied were actually contested. So that means that 99% of those claims that were denied ultimately just fizzled out, and the insurance company didn't pay, and the patient didn't get the care that they might have needed. Now, if you know anything about me and how I view a lot of these insurance plans, that to me is not a good thing. And I really want people who deserve care to get care. and to be as unrestricted as possible. I'll get into more of that stuff later on, but for this video, just know that anytime you deal with an insurance company, we got that wonderful process of the doctor getting to insurance getting back to you, and then you having to appeal or be thankful that they covered your service. I know what you're thinking. You're thinking that, heck, the reason why ACA plans reject so many more than Medicare Advantage is because the amount of services that they offer is less. Well, that's not really true. ACA plans pretty much cover everything that Medicare covers, and Medicare covers pretty much everything that the ACA covers, except for things like Planned Parenthood and a lot of those things. Even dental, vision, hearing actually are not even covered in the ACA plans. That's also an added benefit, just like how it is on Medicare. So the plans are pretty much models of each other, and the ACA was pretty much modeled around Medicare. So it's very similar, coverage-wise anyway. So how do I know what is going to get denied, and is there any kind of way we can kind of figure out if my service is going to be denied or not? Well, there is. There's something called a prior authorization list. And for the regular Affordable Care Act plans, large employer group plans, this is what that list looks like. As you can see, it's pretty vague and pretty much covers everything that could possibly be done for you. Now, what about Medicare Advantage or the private companies that do Medicare plans? What do they say? Well, their list is very extensive and very similar. A wide variety of different services, inpatient stays, surgeries, diagnostic tests, everything under the sun can be requiring a prior authorization. Typically, they use a dollar amount, internally inside their company. They'll figure out a dollar amount where it's, it's allowable to you not have a prior authorization, but that's kind of how they do it. They leave it pretty vague. Oh, Matt, Medicare and AC suck, right? Well, here's the thing. Original Medicare Parts A and B managed is a pretty heavy term, but guided by Medicare have their prior authorization list here. It's very, very specific and pertains to certain billing codes, unlike the other two, Medicare Advantage and the group employer plan, which pretty much give you very vague ideas. So how is this beneficial to us? So on the Medicare program, the original Medicare program that is, forget the ACA, forget Medicare Advantage. Medicare Parts A and B, not D, just A and B. Those services that require PA are very, very, very expensive or very invasive surgeries, like neurological spinal implants. Yeah. Also, durable medical equipment and prosthetics. So things like arms, prosthetic legs, powered wheelchairs. And the reason why those things require a PA is because back, I don't know when, maybe in the 80s and 90s, unfortunately, doctors were utilizing or abusing the system by ordering tons of these products and then selling them on top of already claiming them on insurance. So Medicare in 2004, I believe, somewhere between 1994 and 2004, they first implemented these prior authorizations. So before then, literally any service covered by Medicare could be gotten without any kind of prior authorization or pre-certification. But what's covered? Fortunately, Medicare has that too. They have this website right here, medicare.gov/coverage. And you can see what Medicare actually covers. It's not perfect. It isn't perfect. It's pretty vague, but it's a step in the right direction, and it's more than you're going to get from pretty much any other private insurance company out there. All right, so the second part of our conversation is, all right, so we got services. We know we can get services easier on Medicare, but are there any doctors and hospitals that will even take Medicare as insurance, right? I mean, heck, even though Medicare covers all these great services at this easily accessible rate, maybe it's because no one's going to take me as a patient on Medicare. Well, you're right in the fact that Medicare does pay less to physicians and to hospitals. Now, how much less can be seen here? Your doctor for outpatient services actually doesn't get paid that much less. The average is somewhere around 118% to 140 somewhat percent more they get paid if they have regular ACA or private pay plans. Hospitals is a much larger range, but with that said, In my experience, most doctors will take you if you're on Medicare, as long as you were a patient before, on the group plan or on your ACA plan. Unless they're either one, retiring, or two, you are a bad patient. Now, what about the hospitals? Do I have to go to those federally qualified, receiving tons of money in the ghetto hospitals? No. So most hospitals actually accept Medicare. And if they accept Medicare, they cannot turn away Medicare eligible beneficiaries. Now, what about those super, super high class, fabulous hospitals that you heard of on the news, like the Mayo Clinic, MD Anderson, the Cleveland Health Clinic? All of those accept Medicare and will be happy to see you if you have a Medicare supplement plan and, of course, Medicare Parts A and B. How do you check? How do you check if your doctor or if the hospital accepts Medicare? How do you check if anyone accepts Medicare? Well, Medicare has this wonderful website, physician search or provider search. Well, on this website, you can actually figure out if the provider accepts Medicare assignment. And pretty much all that means is that they accept Medicare payment as full. And if they accept Medicare payment as full, they accept Medicare. And if you have a Medicare supplement plan, they will pretty much accept all of it, no questions asked. You just have to make sure that they have enough space on their schedule to see you. Now, with that all said, Medicare is not perfect. Medicare, like the Affordable Care Acts, don't cover dental, vision, or hearing. Also, Medicare doesn't cover prescription drugs as far as the original Medicare program is concerned. So what should you do then? Well, for the first part of dental, vision, and hearing, it really depends on your needs. Dental plans, in my opinion, are very weak unless you absolutely need certain services. For example, if you need medically necessary cleanings, like you have prediabetes or diabetes or some kind of a ailment that requires you to have medical cleanings, so instead of the standard 2 per year, you need 4, there are certain dental plans that will cover for those extra 2 per year that you need. If you foresee yourself needing a lot of fillings in the future, or crowns, or implants, maybe you can get a dental plan that covers those services at a good rate and that don't have such a low max out of pocket that you won't be able to get much out of it every year. But those circumstances, those situations are more of the exception than the rule. So for those folks who need dental, vision, and hearing, sometimes it's good to either have a bundle plan where all those services are bundled into one option and you have maybe a $1,000 benefit to use toward any of them, or just save the money on the side to have access to a little bit of extra money to pay for the dental, vision, and hearing costs. Now, you might not be able to cover all of it, and that's typically how dental insurance works anyway, but at least you have a little bit of safety net. Now, drugs. Part D prescription drugs. This is a huge problem, especially since, unlike Parts A and B, Part D, as you can see here, does deny services, and they have this thing called step therapy, which requires you to take medication that's cheaper, generic, before you take stuff that's more expensive or from brand name companies. And what that basically means is that you'll be taking stuff that potentially could be harmful to you before you get stuff that might actually work better for you. But Medicare doesn't look at it that way. Part D plans say, hey, this one's economically better for everyone, better on the system, better for the copay of the client, so we're going to try this one first. And that's what step therapy is. And I know I went a little bit further than probably you needed, but just understand that Part D is going to be a problem that we are always going to have until they change the regulations. With that said, the Biden administration is currently trying to get past dental, vision, hearing to be included in original Medicare and to allow Part D drug plans and us as Americans to import cheaper prescription drugs from other FDA verified or other reputable pharmacies from overseas. Think Canada or Europe. So I hope that helps you understand why at least I believe that the original Medicare program is probably the best insurance you can get in America. And if anything new comes as far as Congress and all that stuff, you'll be sure to hear about it here on my channel, or look out for an email. If you're my client, you'll probably get it in an email as well. Now, next video, we'll go over the Medicare costs and how much you're actually going to be paying on the Medicare program now that you know that it's the best one for you.